Welcome to our NCLEX practice test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. A nurse is asked to draw blood in the antecubital AC space. Which of the following veins are found in the AC? A. Cephalic. B. Median cubital. C. Basilic. D. All of the above. Correct answer, D. All of the above. All three of these veins are located in the antecubital space, which is the space opposite the elbow on the arm. 2. The sinoatrial node, SA, is located within which of the following heart structures? A. Mitral valve. B. Right ventricle. C. Right atrium. D. Left atrium. Correct answer, C. Right atrium. The SA node is located within the upper wall of the right atrium of the heart. 3. A nurse is experiencing difficulty managing her patient's postoperative pain following a cholecystectomy. The current medications the patient is prescribed are ineffective, therefore the physician must be notified. The patient is stating, "This is the worst pain I have ever felt in my lifetime." The patient is exhibiting facial grimaces and moaning with repositioning. Which of the following statements should be included in the electronic medical record, EMR, by the nurse? A. The patient states, "This is the worst pain I have ever felt in my lifetime." B. The patient is moaning and grimacing with movements. C. The patient is complaining of severe pain. D. All of the above. Correct answer, D. All of the above. Documentation in the EMR by the nurse should include subjective and objective data. Subjective data should be documented as direct quotes, within quotation marks, or as summarization the information the patient states. Objective data should include information that is observed by the nurse or discovered on assessment. 4. A nurse is working with a client and her 9-month-old son. The mother tells the nurse, "Sometimes, he is so naughty. I had to put him in timeout yesterday for throwing toys." What is the most appropriate response of the nurse? A. Where do you put him when he goes to timeout? B. Keep doing that to teach him the right way. Eventually he will stop throwing toys. C. At this age, he should stay in timeout for 9 minutes. D. Remind him not to throw toys but don't discipline him for this behavior. Correct answer, D. Remind him not to throw toys but don't discipline him for this behavior. Parents who effectively discipline their children should use age-appropriate measures so that discipline is a learning experience. A 9-month-old child who throws toys does not yet understand why it is important not to do this and will not understand the reasons for timeout. 5. A nurse is preparing immunizations for a 5-year-old child who is starting kindergarten. Which statement by the parent indicates understanding of this process? A. Once he gets these shots, he'll never need to go through this again. B. This should be the 3rd vaccine in the 3-part hepatitis A series. C. Most of the kids in his preschool have already had chickenpox. Why does he need a vaccine? D. Last time we were here, he had a slight fever after the vaccines. Can I give him acetaminophen if it happens again? Correct answer, D. Last time we were here, he had a slight fever after the vaccines. Can I give him acetaminophen if it happens again? A child who is receiving immunizations may develop a slight fever or soreness at the injection site. A parent who recognizes this possibility and asks about what medications are appropriate for the child's comfort has understanding of some of the side effects of immunizations. Redness or soreness at the injection site, as well as a mild fever following the vaccine are not contraindications to immunization. 6. A 72-year-old patient was admitted to the hospital for a urinary tract infection, UTI. A nurse is discussing self-care strategies that the patient can perform at home in order to reduce the risk of a recurring UTI. Which of the following strategies would the nurse include in her teaching? A. After urinating, wipe back to front. B. Drink 1 glass of water a day. C. Toilet every 2 hours. D. All of the above. Correct answer: C. Toilet every 2 hours. Teaching the patient to toilet every 2 hours instead of holding her urine is an appropriate self-care strategy to teach to this patient. Answers A and B are wrong, as the procedure to wipe is from front to back and the recommended amount of water is 8 glasses of water a day. 7. A client asks for assistance with correctly preparing bottles of formula for her baby. Which of the following statements should the nurse include as part of teaching? A. If commercial formula is unavailable, substitute 1/2 of the amount with cow or goat's milk. B. Formula must be sterilized before feeding. C. Never heat a bottle of formula in the microwave. D. Always boil tap water before using it to mix formula. Correct answer: C. Never heat a bottle of formula in the microwave. When teaching a client about how best to prepare formula for an infant, the nurse should explain that bottles of formula should never be heated in the microwave. This may result in uneven areas of heating, with some parts of the formula much hotter than others. Because the microwave does not evenly heat bottles, these hot spots can cause burns in the baby's mouth. 8. A client who has entered the hospital for surgery tells the nurse that he wants to try and quit smoking. What is the most appropriate action of the nurse? A. Ask the client if he would like more information about smoking cessation programs. B. Assist the client with throwing out any cigarettes that he has with him. C. Notify the physician that the client needs a nicotine patch. D. Remind the client of the many negative impacts that smoking has on health. Correct answer: A. Ask the client if he would like more information about smoking cessation programs. When a client admits that he needs help with smoking cessation, the nurse can provide resources that will help him to make this decision and stay with it. Most people who smoke are aware of the dangers and negative impacts smoking has on health. Assisting the client with stop smoking information through classes, counseling, or referrals may guide him to continue taking steps to quit. 9. A nurse is providing care to a 7-year-old child in the emergency room. Which of the following interventions may be most helpful in this situation? A. Distract the child with a toy that has flashing lights. B. Provide treatments with the parents out of the room if possible. C. Explain the process of treatment in simple terms. D. Avoid talking about the child's concerns related to treatment. Correct answer: C. Explain the process of treatment in simple terms. When providing treatment that is associated with frightening circumstances for a child who is 7 years old, the nurse should explain what she is going to do and the purpose of the treatments in simple terms that the child can understand. Children of this age may have significant fears related to medical care but can understand if the nurse talks directly to them and does not avoid addressing their concerns. 10. Which of the following persons is at highest risk of developing type 2 diabetes? A. A 40-year-old Caucasian man with a BMI of 27. B. A 48-year-old Hispanic woman with low levels of HDL cholesterol. C. A 39-year-old Asian woman who recently had a baby weighing 8 pounds, 2 ounces. D. A 50-year-old Caucasian man with low levels of LDL cholesterol. Correct answer: B. A 48-year-old Hispanic woman with low levels of HDL cholesterol. There are certain factors associated with a higher risk of developing type 2 diabetes, including age, ethnic background, and the presence of health issues, such as gestational diabetes or high cholesterol. People over 45 years old, those with low levels of HDL cholesterol, and those of Hispanic, Asian, African American, Native American, or Alaskan Native descent are at higher risk of developing type 2 diabetes. 11. The purpose of performing quality control is to A. Create a paper trail to show that the laboratory is compliant with OSHA standards for quality control. B. Improve the odds that the results that are reported for any given test are as accurate and reliable as possible. C. Are required by law to be part of a quality assurance program. D. All of the above. Correct answer. B. Improve the odds that the results that are reported for any given test are as accurate and reliable as possible. Quality controls are done for each analyte tested to ensure reliability of the results obtained from that test. There are no laws requiring that QC be performed, but most accrediting bodies will require QC to be done in order to maintain accreditation. 12. Richard is a 72-year-old with stage 4 lung cancer who has been admitted to the hospital for pneumonia. He is alert and oriented, and states he would like to sign a do not resuscitate (DNR) order. His wife enters the room after he has signed it and is very upset that he has made this decision without discussing it with her. She wants to know what she can do to get the DNR reversed. What should your first response be? A. Contact the unit manager to talk with her. B. Contact the hospital's attorney to discuss with her. C. Try to talk Richard out of his decision. D. Offer caring support for both parties. Correct answer. D. Offer caring support for both parties. Offering caring support for both parties is the best option, since Richard is entitled to make this decision for himself and receive support to do so. His wife's feelings are understandable, and caring support by the nurse will be helpful in facilitating a discussion between them, as well as enforcing Richard's right to make this decision. 13. You are on the unit and overhear another nurse talking on the phone to a patient's friend who wants to see her patient who is comatose and on a ventilator. Since you cared for that patient yesterday, you know that the patient's significant other, who is also the designated healthcare surrogate, HCS, and has power of attorney, POA, has expressly stated that he wants this person on the list for restricted visitors. The nurse whispers that she'll call him to visit as soon as the significant other has gone home. What should your first response be? A. Inform the significant other. B. Report the nurse to the nurse manager. C. Speak with the nurse directly in private. D. Call the visitor and tell him he can't visit. Correct answer. C. Speak with the nurse directly in private. Speaking with the nurse directly and privately is the most constructive manner in which to handle this situation, and advocate for the significant other's wishes. Doing so will open communication with a peer, and build the relationship, instead of alienating the other nurse by taking action which does not involve her and will cast her in a negative light with others. Express your concerns regarding honoring the significant other's requests and rights regarding limitation of visitors. 14. Teresa is an 84-year-old with stage 4 ovarian cancer who has been admitted for a bowel obstruction. She recently stated that she has decided that she doesn't want any further aggressive care and is requesting to be placed under hospice care. Her husband and daughter are supportive of her decision. She spoke with her oncologist about it, and he stated that he did not agree, and wrote orders on her chart for chemotherapy. What would be the best first response to this situation? A. Give the patient a list of other oncologists. B. Tell the family to report the doctor to the State Quality Board. C. Notify the doctor that the patient refuses the chemotherapy. D. Give the patient hospice information. Correct answer. C. Notify the doctor that the patient refuses the chemotherapy. The patient has the right to refuse any treatment, and the doctor should be notified that the orders on the chart cannot be performed, with appropriate documentation. Depending on the doctor's response, discussing the patient's wishes in a calm and professional manner provides the opportunity for him to understand her viewpoint and perhaps support her decision. Providing hospice information is a good second option, as the patient has the right to make this decision, and is able to initiate her own hospice evaluation. 15. Upon entering an elderly patient's room, you find a research assistant with a clipboard, obtaining consent to participate in a new study. After signing the form, the patient begins to ask questions about the study. The assistant smiles and says, "Don't worry about all that, we'll take good care of you. Now enjoy the chocolate I brought." What should your first response be? A. Ignore the patient's questions. B. Stop the assistant and question the consent. C. Notify the nurse manager. D. Notify the research department. Correct answer: B. Stop the assistant and question the consent. The patient has not given informed consent if she still has questions that are not answered prior to participating in the study. The assistant should be stopped, the consent questioned, and the patient's questions answered to ensure she understands all aspects of participation in the study. Additionally, notifications may need to take place as appropriate to prevent this individual from obtaining future consents in an unethical manner. 16. Monica is a 28-year-old nurse who had been admitted to the hospital after a near drowning in which she suffered cardiac arrest and hypoxic encephalopathy. She has been stabilized and has a tracheostomy to room air. She has been on the general floor for several weeks, is in a persistent vegetative state, and has a very poor prognosis for any improvement in her neurological status. Monica had previously signed a living will, which indicated that she did not wish to receive enteral feedings to be kept alive if she had a terminal condition or was in a persistent vegetative state from other causes. Her parents have decided to move her to the hospice unit and have given permission for removal of her feeding tube. The patient care technician who has been caring for Monica is very distressed over this decision and feels that the parents are killing her. What would be an appropriate initial response? A. This will relieve the burden for her parents. B. Her parents have a right to make decisions for their child. C. Monica has stated her wishes and they should be honored. D. The ethics committee should be consulted. Correct answer: C. Monica has stated her wishes and they should be honored. The purpose of a living will is to provide individuals with the opportunity to express their wishes prior to the occurrence of a catastrophic event in which they may not be able to speak for themselves. Monica has clearly stated her wishes, and honoring those wishes is the most appropriate manner in which to advocate for her. Such decisions are sometimes difficult for healthcare personnel, and caring support with appropriate resources should be provided to those with questions and concerns. 17. Jack is a 2-month-old with a diagnosis of spinal muscular atrophy, SMA, type I. He has been admitted to the hospital for progressive respiratory difficulty. His parents have been informed that if he is not placed on ventilatory support, he will continue to decompensate and die of respiratory failure. Jack's physician discusses the poor prognosis of Jack's condition, and tells the parents that he will not be able to be removed from ventilatory support once it is initiated, due to his progressive neurological disease. After much discussion, the parents have decided to decline ventilatory support, agree to a do not resuscitate (DNR) order, and request hospice care for Jack. Another parent heard them discussing Jack's situation in the waiting room and says she could never do that to her baby. What is the most appropriate response to this parent? A. You never know what you'll do until you're in that situation. B. I can't discuss another patient's situation. C. They have been through too much already. D. You can contact administration with your concerns. Correct answer: B. I can't discuss another patient's situation. Privacy regulations prevent healthcare professionals from discussing patient situations with others who are not involved in that patient's care. Providing caring support that protects the privacy of others is sometimes a delicate task, as the waiting room of an intensive care unit is often a very emotional environment. Even if family members share details with each other, healthcare professionals are not permitted to engage in conversations that would breach confidentiality. 18. Albert is a patient in the hospital who is scheduled for surgery the following morning. After the preoperative visit from the anesthesia staff member who has obtained surgical consent, Albert asks for an explanation of what type of surgery he is going to have. He states that he's not sure what he just signed. What is your best response? A. Don't worry, they'll explain it in the operating room. B. It's standard procedure to get the consent, you don't need to worry. C. Let me ask the nurse anesthetist to come back and explain it further. D. Someone will review it with you prior to surgery. Correct answer: C. Let me ask the nurse anesthetist to come back and explain it further. If the patient does not understand what he consented to, it is not an informed consent, which is required prior to surgery. The staff member who obtained the consent should be notified that the consent is not valid, and a request made for the patient to receive an additional visit with further explanation and new consent obtained. 19. If a nurse prevents intentional harm from occurring to a patient, which ethical principle is she supporting? A. Beneficence. B. Non-maleficence. C. Justice. D. Fidelity. Correct answer, B. Non-maleficence. Non-maleficence is the ethical principle of preventing intentional harm. Beneficence is the ethical principle which means to do good, not harm, to others. 20. What ethical principle has led to the need for informed consent? A. Autonomy. B. Justice. C. Fidelity. D. Beneficence. Correct answer, A. Autonomy. Autonomy is the ethical principle that states that patients have the right to make their own decisions for themselves, if they are mentally competent to do so. Informed consent has been one of the outcomes of this principle, since patients should be thoroughly educated and informed prior to providing consent. Autonomy is often a difficult concept for healthcare professionals, since patients often make decisions for themselves which healthcare professionals do not always agree with. 21. Victor is a 43-year-old patient who is HIV positive with a diagnosis of pneumocystis carinii pneumonia, PCP, who has been admitted to the hospital. His prognosis is very poor, and his partner, Roger, would like to have a ceremony performed in his room to honor their union in case something happens to Victor, who is in agreement. What is the most appropriate response to their request? A. Inform him that Victor is too ill for a ceremony. B. Ask the social worker to intervene. C. Tell him it's against unit policy. D. Coordinate with other disciplines to support their request. Correct answer, D. Coordinate with other disciplines to support their request. The most appropriate caring response is to respect their relationship and honor their wishes. A multidisciplinary approach supports their needs and will help facilitate the process. According to the ANA Code of Ethics, nurses must treat all persons with dignity and respect regardless of personal viewpoints on any given issue. 22. Hospitalized patients who are allowed to administer pain medications to themselves are connected to a PCA or underscore. A. Patient-connected anesthetic. B. Patient-communicated analgesic. C. Patient-controlled analgesic. D. Patient-communicated anesthetic. Correct answer, C. Patient-controlled analgesic. Patient-controlled analgesic, PCA, is a medication delivery system that allows patients to press a button whenever they feel pain, in order to deliver more medication intravenously. Nurses calculate a lockout rate into the connected pump, in order to prevent patients from overdosing. 23. Which of the following would be an acceptable route for the delivery of parental nutrition for an NPO patient? A. Pills. B. Intravenous. C. Liquids only. D. Aspirate. Correct answer, B. Intravenous. Nothing by mouth is represented by NPO. NPO patients receive nutrients and vitamins intravenously. While receiving parenteral treatment, patients are not allowed to orally consume. 24. 4-push and 4-piggyback are different nicknames for the same method of administering medication. A. True. B. False. Correct answer, B. False. 4-push and 4-piggyback are not the same. 4-push means that medication is injected directly into an 4-line. 4-piggyback is a small bag, about 50 milliliters, that is delivered to a patient according to a drip rate or number of drops per minute. 25. After administering a drug, the time when the body first starts to respond to the medication is called A. Plateau. B. Peak plasma level. C. Onset of action. D. Drug half-life. Correct answer, C. Onset of action. The onset of action is the time after a drug administration in which the body initially responds to the medication. Some drugs may have a rapid onset of action but a short half-life, while others may have a slower onset, but their effects last longer. 26. The Controlled Substance Act categorizes substances into groups based on varying qualifications such as currently accepted medical use and potential for abuse. A. 3. B. 4. C. 5. D. 6. Correct answer, C. 5. Controlled substances are categorized into 5 groups. Schedule 1 is reserved for drugs with no medicinal purpose, such as crack cocaine and heroin. Schedule 2 drugs have accepted medical uses and high potential for abuse. They must be kept in secure locations. Schedule 3, 4, and V have relatively low potential for abuse compared to Schedule 1 and 2 and may be stored on shelves among routine medications. 27. If a patient received a prescription for Ventolin HFA with the instructions 2 puffs TID, how many puffs per day is the patient instructed to take? A. 2. B. 4. C. 6. D. 10. Correct answer, C. 6. The patient should inhale a total of 6 puffs per day. Since TID means 3 times daily, 2 times 3 is equal to 6 puffs every day. 28. A PRN order is an order for a medication that is used on a N_ basis in a hospital. F. Regular. B. Every day. C. As needed. D. Nightly. Correct answer, C. As needed. PRN is a medical term that means as needed. PRN orders are requests for mediation that is not used on a routine basis. Instead, PRN medications are used only when the patient needs it, such when Phenergan is used for nausea and vomiting. 29. Systemic action pertains to action throughout the body and not at the underscore of administration. A. Site. B. Time. C. Source. D. Method. Correct answer, A. Site. Systemic action pertains to action throughout the body, as opposed to the site of administration. 30. The duration of a drug's action is commonly referred to as its underscore. A. Half-life. B. Response time. C. Efficacy. D. Action potential. Correct answer, A. Half-life. The duration of a drug's action is commonly referred to as its half-life. This is the measure of the amount of time it takes for half of the drug to be inactivated by the body. 31. What do palliative drugs do? A. Prevent symptoms. B. Cure symptoms. C. Relieve symptoms. D. Trigger symptoms. Correct answer, C. Relieve symptoms. Palliative care is the treatment of symptoms by relief instead of cure. Palliative treatment is often provided to terminal patients, such as chemotherapy patients. 32. A physician order for a 120 mg dose of gentamicin 40 mg per milliliter should be filled with underscore of gentamicin. A. 80 milliliters. B. 5 milliliters. C. 3 milliliters. D. 60 milliliters. Correct answer, C. 3 milliliters. The correct answer is 3 milliliters because for every 1 milliliter of gentamicin medication there are 40 milligrams. 40 milligrams x 3 equals 120 mg, which is the same as desired dose of 120 milligrams, 33. Which fact about diabetes is true? A. Only children get type 1 diabetes. B. Only adults get type 2 diabetes. C. Children and adults can have type 1 diabetes. D. Both A and B. Correct answer, C. Children and adults can have type 1 diabetes. Both children and adults can have type 1, or insulin-dependent, diabetes. Although type 1 diabetes is also referred to as childhood diabetes, it affects adults as well. Both children and adults can also have type 2 or adult-onset diabetes, primarily due to the fact that some children are obese. 34. Diabetic patients are more prone to underscore than other people without this chronic disorder. A. Infection. B. Increased oxygen saturation. C. Low fibrinogen. D. Constipation. Correct answer: A. Infection. Diabetic patients are more prone to infection than other people without this chronic disorder. Diabetes has no direct impact on the other disorders above. 35. A common childhood illness is caused by the Bordetella pertussis bacterium. Which of the following diseases is caused by this bacteria? A. German measles. B. RSV. C. Meningitis. D. Whooping cough. Correct answer: D. Whooping cough. Bordetella pertussis is the causative bacteria for the disease state of whooping cough. Meningitis can be caused by bacteria, but is not caused by the B. pertussis bacteria. German measles and RSV are both caused by viruses. 36. A patient that has been diagnosed with alopecia would be described as having a. Body lice. B. Lack of ear lopez. C. Indigestion. D. Hair loss. Correct answer: D. Hair loss. Alopecia is a medical term meaning hair loss. 37. A child is diagnosed with a green stick fracture. Which of the following most accurately describes the broken bone? A. Compound fracture of the fibula. B. A partial break in a long bone. C. Fracture of the growth plate of the ulna near the wrist. D. Cole's fracture of the tibia. Correct answer: B. A partial break in a long bone. Green stick fractures are commonly found in children. Sudden impact of a bone could lead to the bone bending and partially breaking, such as what is seen when a green stick from a tree is bent in half. 38. A patient with Bell's palsy would have which of the following complaints? A. Paralysis of the right or left arm. B. Malfunction of a certain cranial nerve. C. A subcondition of cerebral palsy. D. A side effect of a stroke. Correct answer: B. Malfunction of a certain cranial nerve. Bell's palsy has symptoms similar to stroke, but is caused by a malfunction of the facial nerve, which is cranial nerve 7. 39. A pathologic condition described as increased intraocular pressure of the eye is A. Detached retina. B. Fovea centralis. C. Presbyopia. D. Glaucoma. Correct answer: D. Glaucoma. Glaucoma is a condition that is caused by increased intraocular pressure in the eye. If not treated, glaucoma can lead to blindness. 40. A patient presents to the office with a pencil that has completely penetrated the palm of her hand. Which of the following treatments would be best in this situation? A. Assist the doctor while she sedates the patient and removes the pencil from her hand. B. Have the patient gently pull the pencil out of her hand and assist the physician with stitches. C. Wrap a gauze wrap around the pencil, securing it as much as possible until the patient can get to a local emergency room. D. Tell the patient to go to the local emergency room. With a doctor's order, give the patient some aspirin for the pain. Correct answer: C. Wrap a gauze wrap around the pencil, securing it as much as possible until the patient can get to a local emergency room. Penetrating wounds that leave behind an object may have broken and then blocked important blood vessels. Removing the object may cause intense bleeding. The patient's wound should be gently wrapped with the object intact. The patient should then be taken to the nearest emergency room to have the object removed. 41. Of the following, which best describes why subdural hemorrhages are more common in the elderly? A. Increased anticoagulant use. B. Increased risk of falls. C. Brain atrophy. D. Inconsistent caregiving. Correct answer, C. Brain atrophy. The elderly are at higher risk for subdural hematoma due to cerebral atrophy that occurs as a normal part of the aging process. Such atrophy may cause stretching of the bridging veins, which are then more fragile and susceptible to tearing, even with minor trauma. The other factors noted may contribute to the morbidity and mortality of subdural hematomas in this population. 42. Renal failure is broadly divided into specific categories. Which type is the type 2 diabetic patient most likely to experience secondary to the diabetes? A. Acute renal failure, ARF. B. Intermittent renal failure, IRF. C. Chronic renal failure, CRF. D. Reversible renal failure, RRF. Correct answer, C. Chronic renal failure, CRF. Chronic renal failure, CRF, and acute renal failure, ARF, are the two broad categories of renal failure. Diabetic nephropathy is common in the diabetic population and an increasing cause of chronic renal failure, CRF, in the United States. Other common causes of CRF include chronic glomerulonephritis, chronic pyelonephritis, polycystic kidney disease, connective tissue disorders, and amyloidosis. Chronic renal failure, CRF, differs from acute renal failure partly in the time frame of disease onset and reversibility of the disorder. If treated in a timely and appropriate manner, ARF has a much better prognosis and is usually reversible. Chronic renal failure is not reversible. Depending on severity, patients may be placed on renal replacement therapy, RRT, and may be candidates for kidney transplant. 43. Tommy R., your 68-year-old patient, is at risk for falls. He has fallen 3 times in the last month. You should keep Tommy's underscore in order to prevent him from falling again. A. Bedside rails up at all times. B. Bed in the low position. C. Call bell within reach. D. Family members in the room at all time. Correct answer, C. Call bell within reach. A nurse should keep all patient call bells within the patient's reach so they can call for help and assistance when they need it. This prevents falls. Although low beds are highly useful because they decrease the extent of injury when a patient falls, they do not prevent falls. It is not realistic to expect family members to remain in Tommy's room at all times. Lastly, side rails do not prevent falls and, in fact, they increase the severity of a fall when the patient climbs over them. Also, side rails to prevent falls are considered a restraint and patients often get entrapped in side rails. 44. A home care nurse is instructing a patient about routine ostomy care who was recently discharged from the hospital following a bowel resection. The following statement by the patient indicates that the patient understands the nurse's instructions. A. The stoma should be dry and pink. B. I should cleanse the area with soap and water. C. When measuring the skin barrier, I should add 1 inch outside of the stoma. D. All of the above. Correct answer, B. I should cleanse the area with soap and water. Mild soap and water should be used to cleanse the skin where the stoma is located. The stoma should appear pink, shiny, and moist. When measuring where to cut the skin, only the barrier should be able to be seen through the opening. 45. Albert B. is incontinent of urine. He also wears glasses and hearing aids. His underscore leads to his risk for falls. A. Incontinence and loss of vision. B. Loss of vision. C. Incontinence. D. Loss of hearing. Correct answer, A. Incontinence and loss of vision. Albert B. is at risk for falls because of 2 factors. His incontinence and his loss of vision are 2 risk factors associated with falls. This is the best choice for this question. 46. Mr. Freeman has difficulty getting out of bed. The nurse should encourage Mr. Freeman to underscore. A. Ask for assistance before getting out of the bed. B. Remain in bed because it is safer and he will not fall. C. Instruct him to stand up quickly from the bed. D. Lean forward and push up and off the bed. Correct answer: A. Ask for assistance before getting out of the bed. The nurse should encourage Mr. Freeman to use his call bell and ask for assistance before getting out of bed. This can prevent him from falling. Patients should not stay in bed, they should be encouraged to get out of the bed as much as possible. Quick movement from a lying to a standing position is not advised. It can make the patient dizzy and they may fall. They also should not lean forward and push up, they should ask for help. 47. A nurse has applied a cold pack to a client's arm to help decrease swelling and inflammation after an injury. Which of the following signs indicates that the cold pack should be removed? A. The skin on the arm appears mottled. B. The cold pack has been in place for 10 minutes. C. The client complains of feeling nauseated. D. The capillary refill in the area distal to the arm is 2 seconds. Correct answer: the skin on the arm appears mottled. When using a cold pack for therapeutic purposes, the nurse must monitor the site to avoid tissue damage. Cold therapy that has been used for too long may result in pale, mottled skin that has a bluish appearance. The client may also complain of feeling cold, or circulation to the area may be diminished. 48. A client is undergoing treatment for alcoholism. 12 hours after his last drink, he develops tremors, increased heart rate, hallucinations, and seizures. Which stage of withdrawal is this client experiencing? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Correct answer: C. Stage 3. With recovery of significant alcoholism, stage 3 of alcohol withdrawal typically begins approximately 12 to 48 hours after the last drink. Stage 3 encompasses the symptoms associated with stages 1 and 2, such as tremor, tachycardia, mild hallucinations, hyperactivity, and confusion. By stage 3, the client may have severe hallucinations and seizures. 49. Which of the following nursing interventions is essential when working with a client who has antisocial personality disorder? A. To monitor intake and output. B. Set strict limits on behavior. C. Provide diversion for the client. D. Limit visits from family or friends. Correct answer: B. Set strict limits on behavior. Antisocial personality disorder is associated with manipulative behavior from the client, which may extend to nurses, the client's family or friends, or other clients in the hospital. The nurse must set strict limits on behavior to avoid letting the client manipulate others, act impulsively, or tell lies that are behaviors often associated with this disorder. 50. Which is a true statement regarding stress-related disorders? A. Stress-related disorders are only caused by stress. B. Symptoms of stress-related disorders would not exist if the client was not experiencing stress. C. Stress-related disorders are also called psychophysiologic disorders. D. None of the above. Correct answer: C. Stress-related disorders are also called psychophysiologic disorders. Stress-related disorders, also called psychophysiologic disorders, are illnesses that develop and are exacerbated by stress. These conditions have a physiologic basis for their development, but extreme stress worsens symptoms. Some examples of stress-related disorders might be hypertension, migraine headaches, fatigue, eczema, or colitis. 51. Which of the following nursing outcomes is most appropriate during the crisis stage of caring for a victim of domestic violence? A. The client will verbalize community resources from which to seek shelter after discharge. B. The client will write a plan to keep herself and her children safe. C. The client will contact an attorney for help with pressing charges. D. The client will be safe and receive treatment for injuries. Correct answer: D. The Client will be safe and receive treatment for injuries. During the crisis phase of caring for a victim of domestic violence, the nurse's priority outcomes are for the initial safety of the client and treatment of injuries incurred because of the abuse. Eventually, the client may be able to verbalize options for self-care after treatment, but the crisis phase meets the client's initial needs for safety and health. 52. Which of the following is a symptom associated with sensory overload? A. Disorientation. B. Drowsiness. C. Emotional lability. D. Depression. Correct answer: F. Disorientation. A client who is experiencing sensory overload may become disoriented when the brain becomes overloaded with too much information. The client may be unable to concentrate. He may develop racing thoughts and restless behavior. Sensory overload occurs when a person is either unable to control the amount of environmental stimuli he is experiencing, or he is unable to process the stimuli that he takes in. 53. A nurse is providing care for a client who has just died. Her son states, "She was the most wonderful mother. There was no one who was a better mother than she was. She was perfect." Which stage of grief is this son experiencing? A. Denial. B. Anger. C. Idealization. D. Shock. Correct answer: C. Idealization. The idealization stage of grief occurs when a person left behind idealizes the loved one who dies. The person may speak about the deceased person in a way that implies he or she was perfect or had no faults. The grieving person temporarily forgets the negative aspects of the person who has died as a method of coping. 54. Which of the following is a true statement about palliative care? A. The goal of palliative care is to provide end-of-life care for a client as he transitions toward death. B. Palliative care provides comfort and support for those who may have a terminal illness. C. Palliative care provides resources for funeral arrangements after death. D. Palliative care is a support network for family and friends after the death of a loved one. Correct answer: B. Palliative care provides comfort and support for those who may have a terminal illness. Palliative care is a type of care that provides support and comfort to clients. In many situations, the client may be experiencing terminal illness, or the client may have a diagnosis that involves severe pain or discomfort. Palliative care differs from hospice care in that the client is not always dying. 55. According to the CDC, people in which of the following age groups are most likely to meet the criteria for major depression? A. 18 to 24 years. B. 25 to 34 years. C. 35 to 44 years. D. 45 to 64 years. Correct answer: D. 45 to 64 years. People aged 45 to 64 years old are most likely to suffer major depression. When all types of depression are considered, patients in the 18 to 24-year age group are most likely to report symptoms of depression. 56. Your patient has been confused for years. Your patient can be best described as a patient with a chronic disorder. A. Physical. B. Psychotic. C. Thinking. D. Palliative. Correct answer: C. Thinking. Patients who have long-term confusion are suffering from a chronic thinking, or cognitive, disorder. Alzheimer's disease is an example of a disorder that leads to long-term confusion and memory loss. 57. A client is in need of hemodialysis for end-stage renal failure. The physician has inserted an AV fistula. Which of the following nursing interventions are appropriate when caring for this access site? A. Assess for clotting in fistula tubing. B. Apply a dressing over the fistula site. C. Assess for a bruit or thrill at the site of the fistula. D. Assess circulation proximal to the fistula site. Correct answer: C. Assess for a bruit or thrill at the site of the fistula. An AV fistula internally connects an artery and a vein. the site is accessed by venipuncture when used for hemodialysis. The nurse should auscultate for the sound of a bruit over the site or palpate a thrill at the site to ensure that it is patent and ready to use. 58. A nurse is instructing a client in the use of his incentive spirometer. Which of the following statements from the nurse indicates correct teaching about using this device? A. Lie back in a reclining position while doing this. B. Take rapid, quick breaths to reach your goal. C. Set a goal of using the spirometer at least 3 times per day. D. Practice coughing after taking 10 breaths. Correct answer, D. Practice coughing after taking 10 breaths. An incentive spirometer is a device used to open the alveoli of the lungs. It may be used with clients to reduce the incidence of lung atelectasis. The nurse should instruct the client to sit up and take slow deep breaths to reach his set goal. Following use, the nurse should encourage the client to cough in case using the spirometer has loosened any secretions. 59. Which of the following interventions should the nurse use when working with a Jackson-Pratt drain? A. Strip the tubing to remove clots by milking the tubing back toward the client. B. Empty the drain when the amount of fluid reaches 25 cubic centimeters. C. Strip the tubing to remove clots by milking the tubing away from the client. D. Maintain the level of the drain above the client's incision. Correct answer, C. Strip the tubing to remove clots by milking the tubing away from the client. A Jackson-Pratt drain is type of active wound drain that may be placed following a surgical procedure. This type of drain looks like a grenade, and when collapsed, it actively draws excess blood and fluid out of the wound. If clots develop within the tubing, the nurse can strip the tubing by milking it in a direction away from the client. 60. Which of the following techniques can help to prevent skin irritation or breakdown around a tracheostomy site? A. To manage secretions by providing suction on a regular basis. B. Cleanse the site daily with a mixture of povidone iodine and water. C. Avoid using tube ties to secure the tube. D. None of the above. Correct answer, to manage secretions by providing suction on a regular basis. Excess secretions from the tracheostomy tube can collect near the stomal opening and cause skin breakdown. Management of secretions through regular suctioning will keep the area clean and dry, minimizing skin irritation. 61. A nurse is assisting with a physical exam for a client who presents with possible meningitis. The nurse bends the client's leg at the hip to a 90-degree angle. When she extends the leg at the knee, the client experiences severe pain. Which type of test is this nurse performing? A. Brudzinski's sign. B. Romberg's sign. C. Koenig's sign. D. Babinski's sign. Correct answer, C. Koenig's sign. A client may be tested for meningitis by testing for a positive Koenig sign during the physical exam. The Koenig sign is performed by bending the client's leg at a 90-degree angle at the hip and then attempting to extend the leg at the knee. If the client cannot extend the leg due to pain, this is considered a positive sign of irritation of the meningeal membranes. 62. Which of the following types of dressing changes works as a form of wound debridement? A. Dry dressing. B. Transparent dressing. C. Composite dressing. D. Wet to dry dressing. Correct answer, D. Wet to dry dressing. A wet to dry dressing works as a method of wound debridement, collecting drainage and debris from the wound after application. The dressing change involves applying sterile soaked gauze to the wound and covering it. As the dressing dries, it sticks to the wound and pulls excess debris away when it is removed. 63. A nurse is caring for a client who was recently diagnosed with breast cancer. The oncologist uses the TNM staging system to classify this case as T2, N2, M0. The nurse understands that TNM stands for A. Tumor, necrosis, metastasis. B. Tumor, node involvement, mastectomy. C. Tumor, node involvement, metastasis. D. Therapy, necrosis, metastasis. Correct answer, C. Tumor, node involvement, metastasis. The TNM staging system is a classification system for determining the size and extent of cancerous tissue. The TNM system helps providers to identify the most accurate forms of treatment. The T stands for tumor, then N stands for node involvement, and the M stands for metastasis. 64. Mr. V is receiving treatment for a spinal cord injury after falling off of his deck at home. He has undergone spinal surgery and has been placed in a halo traction device. Which of the following nursing interventions are most appropriate for a client with a spinal cord injury? A. Turn the client and use incentive spirometry each shift. B. Administer stool softeners as ordered. C. Turn the head slowly to avoid further damage to the spine. D. Change NPO status. Correct answer, B. Administer stool softeners as ordered. A client recovering from a spinal injury may be at higher risk of constipation due to decreased mobility. The nurse should assist with preventing constipation and possible fecal impaction by administering stool softeners or rectal suppositories as ordered. 65. Based on assessment and testing, the physician has diagnosed Mr. V with a cord transection at the level of C8 of the spine. Which of the following types of paralysis is Mr. V most likely to suffer? A. Hemiplegia. B. Quadriplegia. C. Paraplegia. D. None. Correct answer, B. Quadriplegia. A client with an injury or cord transection at the level of C1, C8 is most likely to have quadriplegia, or paralysis of all four extremities and the lower portion of the body. Cord transection involves permanent paralysis, but the client may retain some reflexes after the initial swelling from the injury resolves. 66. Which of the following is the correct sequence for removing personal protective equipment? A. Remove gown, gloves, shoe covers, mask. B. Remove mask, gloves, gown, shoe covers. C. Remove gloves, gown, mask, shoe covers. D. Remove shoe covers, mask, gloves, gown. Correct answer, C. Remove gloves, gown, mask, shoe covers. The sequence of removing personal protective equipment is as important as the sequence for applying it. When exiting a surgical or aseptic situation requiring a gown, gloves, mask, and shoe covers, the proper sequence of removal is to first remove the sterile gloves and then the gown. Once these items have been removed, the nurse can then remove the mask and any other protective equipment, such as shoe covers. 67. A home health nurse is preparing to visit her next client, whom she has never visited before. Which of the following actions indicates the nurse is upholding safety precautions? A. Send a text to the client to confirm the location of the house. B. Leave her purse and valuables on the seat in the car and lock the doors. C. Ask the client to keep an extra set of keys in case the car is locked. D. Keep the car windows rolled up when in an unfamiliar environment. Correct answer, D. Keep the car windows rolled up when in an unfamiliar environment. Nurses who work in home health care have some safety standards that differ from the hospital environment. When driving to clients' homes, the nurse can protect herself by keeping the doors of her car locked and the windows rolled up, particularly when driving in an unfamiliar area. 68. The primary purpose of emergency planning is to do which of the following? A. Comply with the laws of the state. B. Comply with the laws of the USC. Comply with both state and US laws. D. Maintain safety. Correct answer, D. Maintain safety. The primary purpose of emergency planning is to ensure and maintain the safety of people and the preservation of objects, such as buildings and personal possessions. There are both federal and state laws that require healthcare agencies to have emergency planning. However, the primary purpose of emergency planning is to maintain life and the safety of people. 69. You must wear gloves when you are underscore. F. Preparing infant formula for a newborn baby. B. Transferring breast milk into a baby bottle. C. Knocking on a patient's door. D. Opening a patient's door. Correct answer, B. Transferring breast milk into a baby bottle. Breast milk is considered a bodily fluid, so you must wear gloves when you are transferring breast milk into a baby bottle. It is not necessary to wear gloves when you prepare infant formula because formula is not a bodily fluid. Lastly, you do not have to wear gloves when you knock on, or open, a patient door. 70. You are taking care of a patient who has active TB. The patient has been put on airborne precautions. The patient is in a special room. You must wear a HEPA mask when you enter the room. Now, the patient has to leave the room and go to the radiology department. How can you transport this patient to the radiology department without spreading the TB throughout the hospital? A. Have everyone along the route to the radiology department wear a HEPA mask. B. Have patients along the route to the radiology department wear a HEPA mask. C. Have staff along the route to the radiology department wear a HEPA mask. D. Place a HEPA mask on the patient. Correct answer, D. Place a HEPA mask on the patient. You would place the HEPA mask on the patient to prevent the spread of the TB throughout the hospital. It is not realistic to expect all staff, patients and visitors along the route to wear a HEPA mask. They are very costly and they require special fittings. 71. A patient's Foley catheter has been discontinued. You will dispose of this patient equipment by doing which of the following? A. Wearing gloves and then placing this equipment in the regular trash can after it is placed in a paper bag. B. Simply placing this equipment in the regular trash can after it is placed in a paper bag. C. Wearing gloves and then placing this equipment into a special, hazardous waste container. D. Simply placing this equipment in the hazardous waste container after it is placed in a paper bag. Correct answer, C. Wearing gloves and then placing this equipment into a special, hazardous waste container. All used patient equipment that has come in contact with bodily fluids is considered hazardous waste. You must wear gloves and then place the Foley bag and tubing into the hazardous waste container. These containers are red and they are clearly marked as hazardous. Bags, rather than containers, can be used. 72. Your AIDS/HIV patient has just died. Should you still use standard precautions as you provide post-mortem care? A. Yes, because the virus is still transmissible. B. Yes, because you must still treat them with respect. C. No, because the virus is no longer transmissible. D. No, because this is not respectful. Correct answer, yes, because the virus is still transmissible. You must still use standard precautions, even when a no HIV+ person is dead. The virus can still be transmitted. Case Study 5. The nurse assumes care of a 20-year-old client struck by a car with a deformity to the left ankle that EMS splinted temporarily utilizing cardboard. 73. The nurse enters the client's room for the initial client assessment. Which action should the nurse prioritize during the initial evaluation? A. Remove the client's clothing. B. Replace the temporary splint. C. Obtain a prescription for pain management. D. Calling X-ray to come to the bedside. Correct answer, remove the client's clothing. The nurse should prioritize removing the client's clothing, which will allow the nurse to complete a head-to-toe assessment after the nurse performs the primary assessment. When a client has experienced a traumatic injury, it is essential to remove the client's clothing to be able to evaluate the client's injuries fully. After assessing all injuries, the nurse should cover the client with blankets to avoid shock. 74. Exhibit 1, Physical Assessment 1345. Neurological, PERLA, GCS 15, Anxious, Alert and Oriented. Eyes, ears, nose, and throat. No secretions noted, no scalp tenderness or swelling, no wounds observed, face is symmetrical. Respiratory. Clear lung sounds bilaterally, equal rise and fall of the chest wall observed, non-labored respirations. Cardiovascular. Tachycardia, brisk capillary refill, +2 peripheral pulses, color appropriate for ethnicity. Gastrointestinal. Non-tender abdomen, soft, non-distended, bowel. Sounds active in all 4 quadrants. Genitourinary, genitalia intact, client is continent. Musculoskeletal, deformity, decreased movement, and swelling in the left ankle. Spontaneous movement to all other extremities. Integumentary, skin warm and dry, multiple abrasions on bilateral knees, over left scapula, puncture wound to the right knee with bleeding controlled. Which of the following findings indicate that the client is receiving adequate circulation to the left foot below the fracture? A. +2 popliteal pulses are palpated bilaterally. B. Full sensation is reported in the foot and ankle. C. Capillary refill is less than 2 seconds on the left foot. D. Skin temperature is cool to touch on the left foot. Correct answer, C. Capillary refill is less than 2 seconds on the left foot. Checking the client's capillary refill distal to the injury is an assessment performed to assess circulation. The nurse assesses capillary refill by pressing the nail bed down and releasing pressure. The color should return in less than 3 seconds. Answer A is incorrect. Palpating pulses is one of the most important assessments when determining if the client has adequate circulation below the level of injury in a fracture. However, the popliteal pulses are located behind the client's knee. The nurse evaluates the pulse distal to the injury. Evaluating the pedal pulse would be the correct location to determine if the client has adequate circulation to the foot, not the popliteal pulse. Answer B is incorrect. The client's sensation is essential to evaluate in a neurovascular exam, especially when assessing a musculoskeletal injury. However, this finding helps determine if nerve damage has occurred. Evaluating the client's capillary refill is more useful when assessing for proper circulation. Answer D is incorrect. The client's skin temperature is important to include in the assessment when evaluating the client's neurovascular status in a musculoskeletal injury. However, finding the foot cool to the touch does not indicate adequate circulation. The skin should be warm and dry. 75. After the nurse performs the initial assessment, which of the following interventions should the nurse anticipate for this client? Select all that apply. A. Obtain an ECG on the client. B. PO challenges the client. C. Apply ice to the left lower extremity. D. Prepare the client for surgery. Correct answer, A and C. It is important for the nurse to obtain an ECG and to place the client on continuous cardiac monitoring after a client experiences a traumatic injury. An ECG is a necessary diagnostic that will help rule out any cardiac involvement. The nurse should also place ice on the client's left lower extremity to help decrease swelling. Ice can be utilized to help decrease swelling in the first 24 to 48 hours following a musculoskeletal injury. Answer B is incorrect. The nurse does not PO challenge the client. Instead, the nurse should maintain the client's NPO status until all injuries are evaluated and it is determined the client will not need any surgical intervention. In addition, it will need to be determined if the left lower extremity fracture needs surgical intervention to realign the bone. Answer D is incorrect. There is no indication that the client will need surgery. The client needs further diagnostics to determine if surgical interventions are necessary, such as an X-ray of the deformity to determine if the fracture needs a surgical realignment. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.